call the meeting to order and then begin by standing and saying the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening, everyone, and thank you all for coming tonight. This business meeting is being held both in person and virtually through Zoom, in compliance with RSU 38's policy BED, remote participation in school board meetings. The meeting is being recorded and will be posted on the maranacook.org YouTube channel. Citizens' comments.
Before you do that, then I'll do
Jay
roll
will-
call. Yeah. So I will do roll call real quick. So board members, whether you're in person or online, please make sure you can hear each other, and then we'll confirm how we'll be voting after the roll call. So having said that, David G.
Here.
Jade Parker is absent. She let us know. Annie.
Here.
Dane Wing, I believe, is online.
Here.
Awesome. Tyler Dunn, also online.
Here.
Thank you. Christine.
Here.
Kathy is absent tonight. Kathy Jacobs. Patty Gordon, I believe, is online.
Here.
Thank you. Rebecca.
Here.
Betty.
Here.
Sean.
Here.
Kelty may be late, so we'll check in with her later. David T.
Here.
And student reps, Esme Jameson is not here tonight and not online. And Eric Nelson.
Here.
Thank you. So just so everyone knows, because we have members in person and online, all votes will be a roll call vote tonight, just so people know. And back to you.
Oh, okay. Citizens' comments, public participation is in accordance with RSU number 38 policy BEDH, public participation at school board meetings. The following guidelines will be followed. For those attending via Zoom, you will notice that the microphones will be muted except during the identified portions of public comments at this meeting. There's a number 4 on tonight's agenda, or this is number 4 on tonight's agenda. If you are viewing on Zoom and would like to speak during the public comment times, please use the chat feature to notify Diane McGregor, and she will communicate with me. In-person speakers, please sign up on the sheet on the clipboard by the door. All speakers, please identify yourself with first and last name and the town you live in. Priority will be given to individuals who live or pay taxes in our member communities, immediate family members of enrolled students, and employees of RSU number 38. Individuals that do have one of these direct connections to our district may or may not be given permission to speak at the discretion of the board chair. That's me for today. We ask that speakers limit their comments to 3 minutes, and if someone who has a similar view as yours speaks ahead of you, please reference their comment rather than repeat the same ideas. We do want to hear from all of our stakeholders and ask that you be respectful with your constructive comments to the board. I would also like to clarify how we address concerns of the public. In accordance with RSU 38 policy BEDH, we welcome all respectful comments and concerns. And we ask that you not use any derogatory comments or use names of or identifying comments of any district personnel. We cannot discuss specific personnel matters in the public setting, but we can listen to broad concerns that folks may have. All speakers are to address the chair and direct questions or comments to particular board members only with approval of the chair. The board will hear and record the comments and questions, but will not debate the matters at this meeting. Board members' questions must be addressed through the chair. Following the meeting, we will take time to research and gather information on the matter, these things that might be brought up, and at the next board meeting, we will follow up with information on the issue. The public is always encouraged to call the superintendent at any time with issues and concerns, because we do need to hear from everybody. Thank you.
Citizen comment time.
It's now time for citizen comments. If no one signed up here, is there anyone online that would like to comment? Okay. With no comments, we get to number 4 on the agenda. Are there any additions or adjustments to the agenda by board or for the superintendent?
I do have one. If we can make it 5F, it's to approve the hiring of Mary Kathleen Small as a 40% French teacher at Maranacook Community High School. So that would be 5F, if everyone's okay with that.
That sounds great. Any other adjustments or additions? None being, let's move to number 5, the action items. The first would be whether we're going to approve the minutes of the October 5th, 2022 board meeting.
I move to approve the minutes of October 5th, 2022 board meeting.
Second.
Is there a- Thank you. Jay will take the vote then.
Sounds good. Dave G,
Yes.
Annie,
Yes.
Dane,
Yes.
Tyler,
Yes.
Christine,
Yes.
Patty,
Yes.
Rebecca,
Abstain?
Betty,
Yes.
Sean,
Yes.
Kelty is not here. David. Oh, she's here. She just came in. We'll wait just a moment and give her a chance to get to her seat. How's that?
Welcome.
Yes.
What are we doing?
We're approving the minutes of the November 5th meeting.
5-8.
Yeah.
Yes.
October.
Thank you. David.
Abstain.
And Eric.
Yes.
Thank you. So we have 2 abstentions and the rest are yes, so the motion passes.
Item B, ratification of the superintendent's acceptance of teacher resignation during the summer. MS Special Education, Kristen Davis.
I move the ratification of superintendent's acceptance of teacher resignation during the summer middle school special education, Kristen Davis. Second.
Any comments or questions?
If I can just explain real quick, this is one that she resigned right at the beginning of the school year and we didn't know a date for when she was leaving. So when we were doing trying to get everyone in line, we missed her. We actually already filled her position last meeting. We filled that RES position, or excuse me, middle school position. I apologize. So this was just an oversight on my part in getting the resignation to you guys. So I apologize for that.
Any other questions or comments? If not, then please.
All right.
Take the vote.
David G,
Yes.
Annie,
Yes.
Dane.
Yes.
Tyler,
Yes.
Christine,
Yes.
Patty,
Yes.
Rebecca,
Yes.
Betty,
Yes.
Sean,
Yes.
Kelty,
Yes.
David T,
Yes.
and Eric.
Yes.
Thank you. Unanimous.
Next, we have item C, 5C, approval of snowplow and salt bids for the 2022 through 2025 years.
I move to award the snowplow bids for the 3-year period, November 1st, 2022 through June 30th, 2025, as outlined by the superintendent. Second.
Any comments, questions?
Jay, what is the percentage increased over the last contract?
Oh, that's a really good question. I have Sean Drinkwater here and I'll ask him to step to the podium and share the answer to that.
So the increase on what I budgeted for this year is $12,934. And this year we are going pure salt too. We're not using salt sand. So it'll melt a lot faster, be less sand and stuff on the rugs, stuff like that. So it has gone up a little bit, but we are going salt also.
And so, if I, go ahead, Tyler.
No, that's fine. I can do that math.
And so we've reduced the sand, and so although it may cost us more in salt, if I get you right, that means we're gonna have a probably significantly less cost in carpet repair and.
Oh, a lot less cost in that, a lot less cost in vacuum cleaner bags. It's all around, it's a lot better thing. I tried for this last year, but I didn't budget enough ahead of time and it was way over. And then I thought I budgeted enough this year, but everything is gone through the roof, so.
Sean?
Considering the cost of fuel, I consider this.
Yeah, I was happy. And
Yeah.
this year we did have a lot of bids, a lot of people bid on it.
Yeah, I remember last year we had to, I don't want to say beg, but.
Yeah.
had to-
So it made everybody sharpen the pencil, so which was good.
Yes.
I had a quick question. Is, thinking out loud always, is there any capacity in the ESSER fund to put towards that increase? You know, it's not
No,
very-
you can't use it for
I
that.
wonder, I knew there
Good
was
question, yeah.
a.
It's good to ask. Though.
Yeah.
And if there are no other questions, then shall we vote on that?
You guys are ready. All right. David G.
Yes.
Annie?
Yes.
Dane?
Yes.
Tyler?
Yes.
Christine?
Yes.
Patty?
Yes.
Rebecca?
Yes.
Betty?
Yes.
Sean?
Yes.
Kelty?
Yes.
David T.
Yes.
And Eric?
Yes.
Unanimous. Thank you.
Next, number 5D, approval of the return to learn plan.
I move to approval of return to learn plan.
Second.
Are there any comments, questions, thoughts that any board members would like to? Yes, go.
I was just concerned about the civil emergency circumstances. And Jay, I think that you had the right answer. And Becky, you and I were talking a little bit about it, but I wanted to make sure I was understanding that right, that it said in case of civil emergency, all mandated requirements by the state will be considered for implementation. And I suppose that doesn't mean we necessarily are required to adopt all mandates.
Absolutely right.
Okay, thank you.
Yep. That's why I worded it that way. We would consider it. But the board would be the one in the end to make the final decision.
Very good.
Yep.
Thank you.
Any other questions or comments?
And I'll just add in if that's okay,
Please.
David. We have to do this. Mandy and I attended a meeting about those ESSER ARP funds. And we were told that we have to update our plan on a yearly basis through the life of the grant. So we needed to approve it this year. And then there'll be one more year that we have to approve it. And if we don't have board approval and or have it posted on the website with a date showing that it was approved, reviewed and approved, then we actually can't invoice for the ESSER ARP funds. So we were all made aware of that through the course of that webinar, and that's a federal requirement, not a state requirement, just so that you guys know that as well. Oh, I think Dane's got a question. Yes.
Please go ahead, Dane.
What, if anything, would make us move off of green, and who could make us move off of green?
Yeah, the only thing that would move us off of green, quite honestly, would be you guys. I would come to you guys if I felt like there was, a huge emergency going on. But I wouldn't do that solo. I think that's a lesson from the pandemic. I would definitely hold an emergency meeting and come to you guys with the information, like if there was a sudden uptick in cases, whether it was COVID or something else, I would come to you guys first. So I think that's a lesson we've learned from the pandemic. Does that answer your question, Dane? I just want to make sure I gave you what you were looking for.
Yes, it does. So this basically is like an outline of
Yeah.
everything that encompasses this return to learn.
Yes. We have
Okay,
to have, very good, that's excellent, because that's exactly, we have to have a color plan. We have to have that, what would we do if we were serving food? How are we addressing people's needs and stuff? So that's why all of the 4 pillars are there, so that way they're addressed. So it's just, that's exactly what they're looking for plan wise. So giving them what they want.
And
Perfect,
I
thank
think, yes, I think it's important for any organization, especially us when we're dealing with so many people and children, to have plans as best we can to address if an emergency or extremely serious situation comes up. And whether we are going to have to do any of these things, we'll hope not any of them. And as you said, Jay, we will need to address it as what we're going to do at the time, but at least we have an outline in place. If there's no other comments or questions, Jay, would you?
Oh, okay.
Mr. Ball?
David G,
Yes.
Annie,
Yes.
Dane,
Yes.
Tyler, Tyler?
Yes.
Oh, there you go. Thank you. Christine,
Yes.
Patty,
Yes.
thank you. Rebecca,
Yes.
Betty,
Yes.
Sean,
Yes.
Kelty.
Yes.
David,
Yes.
and Eric.
Yes.
Thank you. Unanimous.
Our next item would be number E, consideration of the table vote, the board goals.
I move to take the table, to take from the table the motion to approve the 2022-23 school board goals as presented on October 5th, 2022.
Is there-
Second.
Second.
Who seconded that?
Who was it second?
Oh, thank you. And I do have to vote, so. Are you ready?
Okay. Do we take comments and questions on this? Yeah, please.
Overall, I think this is great. My only concern is with the survey with 100% participation rate. I think that's an unattainable goal. And as you all know, I hate surveys. So I think 100% participation rate, especially considering there are only 30 or 40% of the people respond. I think we should strike that out of these goals. I'm fine with the rest of it, the satisfaction levels and all that, but I think 100% participation should be gone.
So before we go any further, we need to take a vote to remove it from the table. And then we can have that discussion. So we just need to be able to take it from the table first. Sorry. Everyone okay with that? David, you okay with that? Okay, so David G. David G.
Yes.
Annie.
Yeah.
And Dane,
Yes.
Tyler,
Yes.
Christine,
Yes.
Patty,
Yes.
Rebecca,
Yeah.
Betty,
Yes.
Sean,
Yes.
Kelty,
Yes.
David T,
Yes.
and Eric.
Yes.
So unanimous, it is now back in play again.
Thank
My
you.
comment still stands.
Okay.
I move that we approve the revised school board goals for 2022-23.
A second.
And so we have that question about whether we should you're suggesting we totally remove any participation
just
percentage.
put something that might be attainable. I'm okay with it being, healthy, just,
Less
I
than
mean,
100.
right. I think 100% is just setting us up for failure
So
right at the beginning.
So is this an internal goal that we have? Because I remember the conversation being, we were going to put out there, yes, unrealistically, but just that we would like 100% participation, recognizing that there was no way we're going to get it. So when we send the survey out, are we still saying, even if that's not verbatim how it's written in our goals, are we still saying when it's sent out that we are aiming for 100% participation, knowing that we're realistically not going to achieve that? I think that's what we mentioned for including it, knowing that we weren't going to get it. So then even if we strike it, are we still going to ask for 100%? I don't know if I'm wording it correctly.
I would be
I
fine
might
if it
strike
said we would aim for 100%, but I don't like that it's saying that that's our goal.
Right.
Is that it's going to be 100%.
I like your suggestion that keeps 100. There's a question.
Patty.
Patty, please continue.
Hang on, I don't know how to get my hand off. Well, I'll do that in a minute, but I just was gonna say, when I put my hand up, exactly what Annie just said, that I thought that that was our aim, and I like the idea of adding the word aim, but I have the same question about, I don't have the paper in front of my face, but I have the same question about the other percentages that we put in here. If it is for internal, I understand that, and I understand them, but like we talked about last time, even the one that was about staff and 90%, maybe we could just add aim to everything if it doesn't already say aim or something like that. That's my suggestion.
I think the word goal is French for aim. I think that they're one and the same.
Yes, I'm just gonna read that too.
So if we put the word goal into these, with the goal of 100% participation rate, with the goal of 90% of the current staff across the district, that would then, and then even down below that, no. Yes, by June 20, the last item, by June 2023, the results of the survey provided for all staff with 100%, with the goal of 100% participation rate will then qualify for everybody in French and English. Sure, go ahead.
Well, that's what they are as goals, so when it doesn't, they're goals.
I see up at the top, the
Yeah.
heading is.
Board of Directors goals for 2022, we don't need, I don't feel we need to add those words, I mean. We want 100% of the people to participate, that's our goal, like.
Do we need to add goal to some of the others for clarification to make sure people understand, or do we leave it as is?
I think the way that Sean just said it makes more sense to me than the way I was reading it before. Because yes, that is our goal, that we want 100%. And the way I was reading it is that I was reading it a little differently.
Well, if you read just the item where it says the participation rate, it's taking it out of context then. In context, it says goals at the top, as you said, Sean. Out of context, which I know nobody does that, but out of context, it could look different. And I'm fine either way. The motion is to take it as it is, if you're okay
I'm
with
fine
that.
with it, yeah.
Any other comments, questions? Then we take a vote.
Are we doing this right? I think we're good, right? I think we're good, right? Okay. Sorry. Yes, yeah. All right, so everyone ready to vote? Okay, so David G,
Yeah.
Annie,
Yes.
Dane,
Yes.
Tyler,
Yes.
Christine,
Yes.
Patty,
Yes.
Rebecca,
Yes.
Betty,
Yes.
Sean,
Yes.
Kelty,
Yes.
David T,
Yes.
and Eric.
Yes.
It is unanimous.
We now have 5F, the addition of approving the hiring of the French teacher. Is there any motion to do that?
I move we approve the hiring of 40% French teacher Mary Small.
Second.
I just had a question, and maybe this is in there and I didn't read it, but is the current French teacher 40%? Are we just taking what we can get or?
No,
what's the-
we are using a program that has online teachers right now for French 3 and 4. And through this, we learned that we need to supplement the conversational French. So this person is willing to do 2 days a week and come in and do the conversational French, with, again, the hopes that next year our French teacher will return as planned. But we knew through conversations with parents and students that we needed something more for the conversational French. Great question.
Thank you.
Any other questions or comments? Let's take the vote. then.
All righty. David G,
Yes.
Annie,
Yes.
Dane.
Yes.
Tyler,
Yes.
Christine,
Yes.
Patty,
Yes.
Rebecca,
Yes.
Betty,
Yes.
Sean,
Yes.
Kelty,
Yes.
David T,
Yes.
and Eric.
Yes.
Again, unanimous. Thank you.
We're at number 6, a workshop for the school-based health center.
So we're going to invite up Sarah Morrill, who is our health center director. She and I and several other people have been having conversations about the health center. We started this conversation actually last spring. So without stealing her thunder in any way, we were lucky enough to get a little bit more funding, which I think Sarah came up with a really good plan on how to use that funding in talking with everyone. And part of that is also a little bit of kind of education and re-education on what's going on in the health center. So having said all of that, I'm going to turn it over to Sarah. She's got a presentation and then she can answer any questions that you have. Thank you, Sarah.
Thank you, Jay. Thank you all. Full disclosure, I get really nervous standing up in front of people. So it's not because I'm uncertain of any of this. I believe in it fully. I'm really, grateful for the opportunity to sort of be here and to share this information. And just like Jay said, I'm really here to share information about the additional grant award that we've received. But I know that the school-based health center model, kind of what we do and why we do it, may not necessarily be common knowledge. And I've only been here a few years, so I haven't had the opportunity to talk with everybody. So please, questions are welcome. And, I think we'll kind of go through the slides and then have some time for questions or, discussion of this as well as kind of the whole thing. So, yeah. Thank you, Becky. So this was a additional grant opportunity that came out over the summer. So for everyone's kind of like level setting, the school-based health center is partially funded through the state of Maine. It does not fund us at the level of like full operation. we definitely rely on some additional funding through the school district to operate. So this is from the this particular like grant language, but it kind of applies to the school-based health center grant funding stream in general. Essentially, what a school-based health center is for is really bringing healthcare, like mental health and physical health care into the school setting with the mission of increasing access for all students, acknowledging that, you know, the adolescent population, the middle school and high school age group begins to experience more barriers to getting, just getting to a doctor's office or getting to a mental health provider, both because of the age and because of the relationships with parents and family, but also that there are significant barriers within our community, transportation, finance, you know, you name it, that might be impacting students' abilities to stay healthy. So bringing that care to the school and trying to reduce the burden on parents to like transport or take kids out of school. Just, you know, the goal is to make it as easy as possible for kids to get health care and miss as little school as possible. So I don't know if these slides have been shared, but we can send that around, and it's, you know, it's yeah, it's a great mission. I love it. So the next slide is also part of the same grant application language. So it's a little bit more specific to what this this additional funding stream that the state opened up this summer, assessing and identifying health risk behaviors. And, you know, it's all kind of part of the same goal of when students graduate from this high school, they are healthy, they've been in school as much as possible, and they're also kind of becoming healthcare consumers. So they're advocating for themselves. They are able to kind of, you know, communicate with a medical or behavioral health provider and take that out into the world. Next one. So this is a little bit, I just put this in today. This is just kind of the other side of what the school-based health center does. This was, we planted tulips today. So this was a collaboration between the health center and a class called Teen Issues, and a number of like different kind of groups coming together. So this is the Yellow Tulip Project. We plant the bulbs in the fall, they bloom in the spring, and it creates like a hope garden. And the Yellow Tulip Project is nationwide, but there are a number of other sites across the state. So, you know, in addition to the like straight up, we have behavioral health providers, we have physical health providers. We're also trying to be part of the school and kind of integrate and just raise awareness and smash the stigma. So, okay, next one. So, oh, that's small. So the current, like the base funding through the state is based on student population, like how many students use the school-based health center, and then the percentage of students who qualify for free or reduced lunch. So that's kind of where we're at. We're fairly small relatively, and we don't have a ton of kids who qualify. At the last, so we're in year one of the big grant, and we're, you know, working toward getting the award for the additional funding. Actually, right now, our base funding through the state is like 43,500. So we're somewhere in between those two. But we have less than 750 students. We have a medical provider on site 8 hours a week. So, so the enhanced operational funding, request for applications came out, I think, in July. Seems like every grant opportunity from the state like happens entirely in the summer. So it's like they release it like July 1 and it's due by August 15th or something. So it ends up sort of being like me by myself writing a grant over the summer, which is fine. And it's, you know, we get lots of input from Jay and central office, and luckily the health advisory committee have input kind of before and after. But this is what new and existing school-based health center sites were invited to apply for. Those are kind of the funding breakdown and the project like categories through the grant. So I think I could be following along. Okay, yep. So this is what we requested, and we were awarded the full amount of our request. So our request for funding for the category of outreach was $2,500, which was the maximum amount we could ask for. So we'll kind of talk, I wanted to sort of introduce like what the project ideas were that went into the grant application. And I want to really say as many times as possible, I'm seeking input on like how to make this work and how to make it meaningful. I think when we closed out last year, I certainly felt, and in talking with, different kind of community members, that it had been a while since the school-based health center kind of like as an entity had really explained itself or been in front of the community that we're serving, and kind of like shared what we're doing and asked what the community, what the families, what the students, what the staff, what the school board and the constituents that you all represent, what you value, and what our priorities should be. We can kind of make stuff up as we go and do our best to be reactive. But I think talking more with everyone, will only help us kind of create the most meaningful and most valuable programs and projects. So for outreach, I think the goal is to get in front of different stakeholder groups and different parts of the communities that we're serving. Some of you may remember going back a decade or more, these sorts of things happened, like community forums. But it's been a long time and, lots has changed. So I think the goal in this 2-year grant cycle will be to do these meetings, to kind of have these community forum meetings with all the towns, with like legislators, with faith leaders, with the staff and the students at the schools, and to try to listen to how we can best serve the students and the families. So hopefully that makes sense. The kind of like breakdown or budget narrative stuff kind of covers the time for staff to participate, and also covers like hiring an outside facilitator to kind of run the show for the meetings itself, and to help with pre-survey, post-survey, kind of the whole data gathering process. So that's kind of one of the projects that was written into the grant. And I think as we're talking about it now, we still don't have the official we were notified of the award. We don't have the official contract. I don't know when the funds will actually be distributed, but it is hopefully, sometime this winter. So we'll kind of have to play it by ear to see when we're actually able to start doing some forums versus kind of pre-work, but definitely by next school year, like by next fall, I'd like to have that kind of, planned out and ready to hit the ground running. Any questions about that one? This one's pretty simple. For infrastructure site improvement, we've requested to purchase a new fax copier printer and a new AED for the high school. So we will move forward with that one unless there's any questions. Okay. So there was a category in the grant that was called, I think, clinical coordination. We requested the full amount of 10,000. And, I'll kind of talk through what the breakdown of what we are hoping to do with it. But that it's essentially funding staff time. For those of you who have not kind of heard this before, we contract our medical provider out through Maine General Health. So Maine General pays our medical provider, who's a nurse practitioner. Maine General pays that provider hourly to be at the school. That provider sees students. We bill like through Maine General when the student has insurance and when it's not an issue. So, you know, most of the time, we're able to bill for the visit. And then we kind of reconcile the hourly rate that Maine General has paid our provider with the amount of revenue that's generated from the visits, if that makes sense. So that's kind of the way we figured out for the past couple of years to do it, so that we're able to like be as efficient as possible when the provider's here. So she, you know, it's worked so far. We had a little bit of a deficit last year, but hopefully this year we're kind of going smoother and hitting the, you know, just we've started a little bit stronger. So hopefully our volumes will be higher this year. So maybe we'll come close to matching up. And I think in the next slide. So there's more information about this in several slides from now, but so I'll say it now and then I'll probably end up saying it again. But the goal for sorry, can we go back to the last one? For the clinical coordination piece is allotting like a $5,000 fund that will offset the cost of our medical provider seeing more students in the health center for free. Does that make sense? Okay. So it's not like it will be money that if we come up with, you know, with a deficit at the end, like maybe we won't. But I think, you know, that's kind of what we're looking to do. And we're looking to increase the variety of kinds of visits that our provider will see students for, including some like no charge visits for that kind of like health risk assessment sort of objective. So we can come back to that one. Okay, thank you. So we can go on. Dental, we were invited to apply for up to 10,000. We only wrote for 5,000 because there's not a real solid plan for our dental piece. We really want to bring like a dental hygiene program back to the high school and middle school. We do have like the state provided fluoride program, but pre-COVID, we did have like hygiene services with kind of mixed reviews depending on how the clinics were run. But it's been harder to restart that post-COVID because I think a lot of those organizations have dissolved or moved on to do other stuff. We've been talking with one organization called Tooth Protectors who is willing to do some clinics for us. But I think they're equally overwhelmed trying to figure out how to do all of the schools that want them. So we're still figuring it out. If anyone in this room has a connection to any dental provider, let me know, because we're definitely not married to any one plan. And we do have some funding. I mean, would like to, dental is a big reason why kids miss school. And it has, you know, been shown to be a need within this community. That's really hard. I mean, the waiting list for dental providers are really long, and especially for kids that have maid care or don't have insurance, it's a significant barrier. So we're going to continue to try to work that out. Would like to have 2 hygiene clinics a year in addition to the fluoride program. Okay.
And hygiene clinics would be basically helping some of the students get their teeth clean.
Absolutely. Yep. Yeah. So it's pretty amazing what like the hygiene programs can do in the schools. I mean, they can do cleanings. They can do some like treatment, like some temporary fillings, those kinds of things. They can do like assessment and even some like referral for, I think that will be a really excellent piece as well. If that hygiene program can then refer students who need more stuff, like help them get to dentist and kind of keep going with it.
And
Yeah.
this would be like the medical part, the other medical part of it, where if there was insurance that would be applied to it. If it
Yes.
wasn't, it would be covered.
Yes.
Thank you.
Mm-hmm. Absolutely. And, you know, and that's the way our behavioral health piece works as well. So if there's insurance and it covers it, they bill it that way. And if not, it kind of falls back to the school funding to offset. So sometimes we pay like co-pays, sometimes we pay the full amount, sometimes the insurance covers the whole thing. So yeah, so this is just the total. So we requested 5,000 for the dental plus 15,600 for the other kind of projects. So we were funded for, you know, a total of 20,600 for 2 years. So this year, whenever this year starts for them and next year. And it was just a 2-year grant. I don't know if they'll extend it. It does seem like oftentimes they do kind of keep these things going. So then circling back to the community forums, like the outreach project, just kind of more information about the kind of preliminary planning that was done around that project. So some of you may know Keeney Tinkham, who actually was the nurse in the school-based health center and one of the like founding mothers of the school-based health center at Maranacook in the 90s. So she now works for the Maine Resiliency Building Network, which is a nonprofit. So she's part of our health advisory committee. She's also like a really excellent meeting facilitator. So she's willing to facilitate these community forums and brings both kind of the content expertise of having, you know, lived experience working in a school-based health center, but it also is kind of removed enough from it where I think can be objective and help keep discussions healthy. So, you know, what we put in the application is really using a combination of written survey tools and community listening sessions, gathering information about what our students and families need. And I think part of that for sure is also communicating what it is we're doing now, because it's not, I think, always easily accessible for community members to kind of know that or to communicate with us. So how to make that all more transparent. So that's kind of that's as far as we've gotten, and we're still talking it through and figuring out a timeline. So. And then this is some more information sort of related to the clinical coordination project. There is certainly a precedent for doing things like this. Other schools, other school-based health centers do what's called health risk assessment visits. And it is like actually like a billable kind of visit for some health insurances. But like, you know, kind of like at its most basic, we have an enrollment process for school-based health center services. So at the beginning of the year, really throughout the year, parents can enroll their kids in the like expanded services at the health center. So they can enroll them in like medical provider services or mental health provider services, or both. That doesn't preclude them from, if they need those services down the road, like we'll call and we can, you know, sort of start that process in a year or whatever. And it also doesn't mean we just do it without talking to the families when they need it. It's just kind of like, it's just a step. It's paperwork to sort of cover ourselves in delivering the care. But it's also, you know, kind of a way that we report back to the state, like how many users we have, like how many students are enrolled in services through the health center. So we've always kind of run at about half, like about 50% of both schools end up enrolled like by the end of the year. So if you can imagine, like with the high school, there are not 400 kids, there's almost 400 kids, but like if there are 200 of those students at the high school that are enrolled in health center expanded services, the health center itself probably sees 75 of those kids throughout the course of the year. The other ones are technically enrolled, but they just, they haven't had a sick visit. They haven't been enrolled. They haven't like started counseling. They just haven't needed us. It's like we're kind of like on demand for them, but they haven't had a demand. So, which is great. Like they're healthy, they're doing good, we hope. But the health risk assessment project would, kind of effectively create a way for all of those 200 students to have a little mini interaction in the health center, do like a very simple kind of health risk assessment screening written survey, like a, 20 questions thing that we use with all of our visits that we see anyway, and then chat briefly with the provider. The goal would be to identify any needs that they have that they're not already advocating for or that haven't popped up on our radar. I don't know how many. It'll be an interesting, a pilot project to sort of see how many of those like mini visits, like the health risk assessment visit, actually, flow into some need that we can meet or, send them out for. So does that sort of make sense? I mean, other schools do it. I think it does have an impact on some students. If there's somebody who's struggling that just hasn't kind of popped up on our radar, we can catch them and talk with them and sort of help them get where they need to go. We have talked about this exclusively as like a no charge visit, like not even touch the billing part. Like it would just be really kind of a intro. This is who our provider is. Just quickly, is there anything we can do to help you? If you don't wear a helmet when you bike, or if you don't get 5 fruits and vegetables, just a very quick interaction, but also talking about substance use and sexual activity and, kind of mental health concerns that might not have landed with somebody that got to us yet. So, full disclosure, it might be controversial. I don't know. Like, I don't know how families will receive it. And that's part of what I really want to hear and be really transparent about. Because, obviously I'm standing here because I think this is a good idea. Yes, I have kids, but like, I don't know what sort of the general consensus is. Because certainly if the majority of families don't want this, then we shouldn't do it. So part of the process is figuring out, do families think this is valuable? And if so, how do we make it as efficient for students and kind of as beneficial for as many people as possible? Okay, any questions? Yeah.
So it would be just for the kids who signed up, right?
Mm-hmm. Yep. I don't know how, I think that's the only way we could do it. And, and if other families who are not yet signed up hear about it and are like, I want my kid to do that, then great. But yeah.
I think it's great. Please go ahead.
Go ahead.
Great to have this outreach and everything that you're trying to make available. That's the most important. I think we need the feedback from people. I don't know if a majority feel a certain way or will feel against it, that would justify to me not doing it. Because if a minority wants it or needs it, they have the right to have their needs met. And as Sean noted, it's not a mandatory thing.
Right.
So we're not forcing it on anybody.
Yep.
Uh,
Yep. And we could definitely create some sort of opt-out, like with anything, but communication, certainly. Yeah.
Congratulations getting the grant.
Thanks.
That's awesome. Grant money. Is there a stipulation where if you don't use it, you lose it? So is there a push to get that money used up, spent?
I don't know because I don't know how it's being distributed, like whether it's they just plunk it down and say, here you go. So more to come on that. Like they have not, I keep asking and I don't want to say they haven't decided because the state probably has some idea of how it will go, but they're not sharing anything.
Okay, that's what I think I
Yeah.
misinterpreted. So this was your outline in the application of what you want to
Yes.
see it applied to.
Mhm.
This is not what they specifically approved the breakdown for, right?
So this is what they approved the breakdown for, but I'm not sure what the timeline is in terms of like using the funds or
Gotcha.
that sort of thing. Yeah. Does that make sense? Yeah.
So I have a question,
Yeah.
aside from funding, which is arguably the barrier that is the great equalizer in terms of barriers. What has been one of or a couple of the biggest challenges for you in running the center? It's been great. I mean, I've heard the parents have been singing the praises of the center. It's been a really wonderful thing for our community, and I'm just wondering what are some challenges, funding aside, that you feel like you're facing on a daily, or just something that comes up commonly?
I think it's, I guess, sort of two things. I think it's being sort of quick enough to respond to kids who like need stuff right now. Like our provider's not always there, our behavioral health provider, there's always one there, but they're not always available because their schedule is full as well. So I think it's the kind of like ability to be super efficient in like pivoting to respond to what's happening right now. I think that's just probably unavoidable. But I mean, I think that's the most honest answer to the question is just having enough kind of like resources, like people available to kind of meet kids when they need them. Because it's been, the mental health challenges have been really significant already this year and certainly last year. And, we're all trying our best to be ready. But there are like kind of system barriers for getting into like our behavioral health counseling, those kinds of things. I mean, it's not just oh, you're here, you're struggling, like here's, the person that will help you. It takes definitely some steps and requires, family involvement, and sometimes the situations are just complicated. So, so there are delays. Right. So there's like a challenge that I have absolutely no idea for solution, but I think that's kind of the ongoing struggle. And I think the other challenge is not necessarily, not completely separate, but I think it's identifying kids that have needs that we don't know about. That, there are a number of kids who come to the health center a lot. And for those kids, the health center works great. But I think there's another group of kids that don't know necessarily how to access it, or, that don't come. So it's kind of like how to bring the program side beyond kind of just these are the providers we have, here are the appointments you can make, like how to kind of bring that message to the big picture, school communities, and do more of that kind of outreach. Yeah.
I had a suggestion that came to mind. Have you guys done any work with the Maine Sexual Assault Crisis and Counseling? Because they're amazing. And it's not even just sexual abuse, but it's a really great program that they do for outreach about boundaries, respect, and they're another great resource too. So I'm glad to hear you guys.
Yeah.
link up
So,
with them.
I mean, it's an awesome suggestion, and, and frankly, I'm super excited. So I joined the health center in February of 2021. I feel like now suddenly like there's a little bit of like energy shift where now we can start doing more, like stuff like that because it's not all COVID and people can't be in the same place, so I think there's a lot of like new opportunities that that we'll be able to bring in more people like that. So we did like a little mini health fair around homecoming where we had, some stuff about sexual consent and kind of like healthy behaviors and stuff like that. I think would like to do more of that. Being totally honest, I want to make sure that everything that we're bringing in and, everything we're doing, we're being kind of transparent and communicative to the community so that nothing can be kind of misunderstood. So, yes, we're having like Maine family planning come into the school, but we're not, but this is the boundary. This is what, we're not giving anything out. We're just educating. If they need supplies or they need something, then they're still coming and talking to the nurses, they're coming and talking to myself and Anya and getting, kind of another level of support. Those kinds of things that we're trying to tread lightly, in part because we're not sure how the community feels about stuff like that. So, but yeah, that's an awesome suggestion.
The grant funding,
Yeah.
is this for services that we provide right now? This isn't something new, right? Because don't we provide these services already?
Yeah, so the base funding is for what we provide already. This was like kind of a new additional amount of funding for new stuff that we're doing. So like for new projects.
Okay.
Yeah. So we're not going to take anything away. It'll be, kind of like a supplement to do new initiatives.
Any other questions? Any questions from board members online? Thank you so much
Yeah.
for presenting this, and working so beautifully with our students.
Oh.
Patty, what would you like to say? Thank you.
I just wanted to say what you were about to say. I think, Sarah, that was awesome. And for somebody who doesn't like to speak in front of people, you were amazing and articulate and informative and so helpful. And I think that it is wonderful that there's this opportunity to revisit and reestablish like community connection and communication and all of that. And it is just fantastic. So I really appreciate all the work that you've done to get our community to this point through the work in the school-based health center, and you're doing a ton and you are totally appreciated.
Thanks, Patty.
She said it. Thank you.
Okay. Yeah.
Yeah.
So feedback is welcome. I don't always understand the rules about how to, I don't know, how to move forward, like what the next steps are, but feel free to reach out to me anytime if you have more thoughts, and I'll try to keep everybody posted on when this will kick in, I guess.
Thank you, Sarah.
Thank you, Sarah.
Next item on the agenda is reviewing norms. And that is, I don't think we had anyone appointed to watch our norms, but did anyone notice something where, someone's getting nasty with someone else or just being inappropriate as far as the way we should behave as a board? We'll look forward to that continuing. If there's nothing else, is there a motion to adjourn?
Will we adjourn? Second.
We're adjourned.